The following Health Matters segment is sponsored by HMG.
Well, you've probably heard the saying, an ounce of prevention is worth a pound of cure. It's very true. Taking good care of your health, getting the proper screenings on time saves money and lives. In tonight's Health Matters, we talk about preventative care and why it's so important.
Dr. Chuck Bolick has been practicing medicine in Bristol since 1994. As a family medicine physician, he works with patients of all ages, helping them live their best life.
Over the past several years, medicine as a whole has made a concerted effort to really try to improve that, trying to work with people to get them looking at things to try to improve their health.
Improve their health by working on things they can change.
So we see hypertension or high blood pressure, diabetes, heart disease. This area, unfortunately, is known as the stroke belt for good reason. So strokes as well, all of those things that come together. So we have an opportunity, if we can work with people, to get them making healthier choices to turn that around.
Turning things around, preventing what can be prevented. That is the key, not only for a person's well-being, but also from a financial standpoint.
We feel like if we can get people going in better directions, the cost of diabetes is staggering, and it's an epidemic, across the country, but especially in this area. And of course, there's genetic components. So it's not that we necessarily may be able to prevent it, but we can certainly delay onset and minimize progression and minimize the complications to help people to better lives.
Developing a long-term relationship with your physician is so important. Annual wellness exams are a big part of that relationship.
It's focused in on not so much physical findings, which not too often are things that we would find, but more looking at what kind of things that an individual should be doing at this stage of their life, because it's going to vary according to age and sex. But even young people, there are things we can look at: blood pressure, cholesterol, but then we get into more cancer screening as people get older, as well as the metabolic stuff like diabetes and heart disease.
And insurance companies are also taking note, changing the way in which certain tests and screenings are covered.
The insurance system for a long time was set up based on an illness kind of scale, and they did not necessarily cover a lot of preventive measures. They've heard the same. They've seen the statistics, they've heard the same things we have, so they've gradually been changing. So fortunately, more and more of the plans now will cover, wellness kinds of incentives.
To read more about prevention, you can visit the Health Matters blog at holstonmedicalgroup.com.
The preceding Health Matters segment was sponsored by HMG.